5 things to remember about Streptococcus suis. Streptococcus suis is a commensal bacteria of the upper respiratory tract of swine. That means it's part of the normal flora. There are 35 serotypes that have been identified for Streptococcus suis. The most common in the US are serotype 1, 1, 2, 3, and 4. Serotype 2 is the zoonotic serotype. Most of the infections have been reported from Central Asia. It's still pretty rare in the United States. However, people that are handling pigs, usually for their work, are more at risk of this zoonosis. Pigs that are the most affected by Streptococcus suis are between 5 and 10 weeks of age, which means that they are in the nursery phase. Pigs become infected with Streptococcus suis in the birth canal, usually from the sow, so most of the pigs in the US are positive for Streptococcus suis. However, not every one of them shows clinical signs. The mobility is pretty low, usually between 10 and 20%. Clinical presentations are the peracute form, where we have sudden deaths of healthy-looking, really nice big pigs. The acute form, where we have meningitis signs when the pigs are on their side, they cannot stand up. You can see paddling, nystagmus, and some of the pigs in the pen have that drunken walk and head tilt sometimes. In the more chronic forms, you can see lameness with swollen joints. Sometimes you will have pneumonia, but it's mainly because Streptococcus suis is an opportunistic pathogen. So if a pig gets infected with a virus like PRRS or PCV2, for example, then Streptococcus suis will come after that and infect the lung as well. The diagnosis is made by culture and isolation, usually on brain tissues or joint swabs. Be mindful that if you have a sample that is positive for Streptococcus suis, but the sample is being taken in the upper respiratory tract, such as oral fluids or nasal swabs, this doesn't mean anything because Strep suis is part of the normal flora. Antibiotic treatment, usually with ampicillin or amoxicillin, is pretty effective. However, antibiotic resistances are more and more common for Streptococcus suis, so susceptibility tests should be done as well. Cleaning and disinfection of the barn is really important to avoid contamination of the environment. However, eradication is pretty much impossible because pigs get infected with Strep suis in the birth canal. So it's really hard to have a Strep suis negative herd.